Muriel. This is Nurse Muriel. To my new subbies, hey, how y'all doing? Sorry for not looking right into the camera, but I am driving, so I'm trying to keep my eyes on the road. But to my new subscribers, hey, how y'all doing? To my oldest but goodies, welcome back. As always, I am Muriel. I am Nurse Muriel. I've been a nurse for 24 years now, LPN for 18, and registered nurse for the past 6. And I make these videos about nursing life, different little things. Trying to be more consistent, y'all. And I'm also, in my videos, I will be talking about weight loss, because I'm on a never-ending weight loss journey. And yeah, so let me turn this air down so y'all might can hear me better. That's my son in the back. For those who aren't new, y'all know on the weekends we go stay in another part of South Carolina, and on the weekdays I am home. I'm working. I currently have a job where I work Monday through Thursdays. Perfect schedule, off every Friday, Saturday, Sunday. So it is Monday. It is post Father's Day weekend. Belated Happy Father's Day to everyone that, you know, to all the amazing, wonderful fathers out there in YouTube land. Hope you enjoyed your day yesterday. Hopefully someone threw something on the barbecue for you, or either you were out there barbecuing, or, you know, hope you enjoyed your Father's Day. So wanted to talk about something I saw on social media. Y'all know I like to come from a social media aspect when it comes to lately I've been coming from a social media aspect when it comes to nursing. And I saw a video a young lady, she did, it came down my Facebook reel, and she was talking about getting her RN degree but remaining on her current job that she works as an LPN. And, you know, people were all down the timeline, and they were, you know, saying, you know, basically like, what sense does that make? And, you know, some of them were saying LPNs weren't nurses. Y'all know that age-old adage. Y'all know how people, they like to say LPNs not nurses, when LPN literally means licensed practical nurse. The skill set may be just a little different than the skill sets RNs are trained to do. But when I say it's a little different, it's a little different. Even the way they teach you to think in RN school, when you're in school for RN, it's a different way that they teach you to think when you're in school for LPN. But in certain situations, in certain circumstances, say in the hospital or in long-term care, you'll gain those critical thinking skills. The LPN will have the patients, the same patients with the same disorders and diseases that an RN will have, and you will, if you're on the same floor, you'll have the same patients, and you will gain those critical, you'll develop those critical thinking skills. You will have to, because that person's life is in your hands. So I would say they do instill the critical thinking aspect more into you in RN school. You'll have to notice those changes in your patient. You're going to receive the same orders. The doctor isn't going to say, oh, well, this nurse that has him a day is an LPN, so I'm not going to prescribe this IV push med. No, he's going to prescribe that IV push med, you as an LPN in certain states, because I'm learning they're saying in some states LPNs can push IV meds. I didn't know. But he's still going to order that medication for your patient. You just have to get an RN to push it. You know what I'm saying? So it's no different. Even in the nursing home, if an RN has these patients, our residents, and the LPN has them, he's not going to change his orders based on what the licensure that the nurse has. He's going to order what's best for the patient, and it's on the nurse to either know why he's ordering that, or to learn why he's ordering that. So, you know, sometimes doctors can order things and you don't know why he's ordering it, and you have to do your research to find out why he's ordering it. Or if he's a friendly doctor, sometimes you can ask him, okay, you can ask them why he's ordering it. Now, that's on a doctor by doctor case. Some of them love to teach as well as, you know, they love to teach, so they will break some things down for you. Some of them, you know, it might be like, don't question me, you should know this already. So I would take that on a doctor by doctor case, as far as asking, hey, why did you order this? You know, something like that. I mean, like, I'm the type of nurse, I like to teach, I like to teach. And so I will explain, like I've done before several times. If I know somebody's in school, say for their LPN license or whatever, and I have to replace a G-tube on a patient, I'll go to that, you know, most of the time it's a CNA. I'll go to the CNA, I'll be like, ain't you in school for nursing? And she'll be like, yeah. And I'll be like, you want to see me pull the G-tube and replace it? You want to see me put this Foley in? Like, I do those type of things. I knew I had a nurse who was in school for her RN, and she was an LPN, and I had to pull a PICC line in the nursing home, and I asked her, you want to see me pull this PICC line? Like, sir, I'll pull people to the side and I'll let them see me hands-on do things, and And then I'll explain to them the documentation you have to do behind those things, like measuring it, saying how the ends look on the pick line, if they're ragged or smooth, measuring the pick line, because if the measurement is off from what was actually put in there, then maybe part of the pick line broke off. I'll teach them how to document procedures as well. But back to the original thought of this video, when it comes to somebody working as the LPN and then staying in that same job, working the same job and obtaining your RN, a lot of people choose to do that because they are comfortable where they are with their LPN. They're comfortable, they like the job, they like where they're working, but they know just by getting that degree, it will increase their rate of pay. And so for some people, it's not about, okay, I want to learn new skills, or I want to, expand my knowledge on doing this job. Some people just want to, hey, I need to make an extra $7 to $10 an hour would really help my household out a lot. And if I have to go back to school for, say if you're LPN and you go back to school, I'm gonna say for 3 semesters, because there are programs that do as long as 3 semesters for the transition program. If I go back to school for 3 semesters to get that extra $7 an hour, I'm gonna do it. And there's absolutely nothing wrong with that. The misconception is people in the public and other nurses act like there's something wrong with that. There is absolutely nothing wrong with that. There is absolutely nothing wrong with that. I think this particular nurse worked in long-term care. She was fine working in long-term care. She was going for her RN license because she wanted to basically make more money. What's wrong with that? If she want to utilize her RN degree to make more money, what's wrong with that? But another thing is, even if she obtained her RN license and she did it for the sole purpose of making more money, she still has more opportunities, employment opportunities open up for her because she obtained that RN. So even if right now she's saying, hey, I want to stay working here, and like I said, there's absolutely nothing wrong with that. And if she's saying, I want to stay working here, and I'm making, say she's making $60,000 a year as an LPN, and I'm not saying that as saying that's all LPNs make, because I know LPNs who made more than $100,000 in a year, but they work for that $100,000. That's what a lot of people won't tell you. A lot of LPNs, they'll say, I made $100,000 a year, but then they won't back up how many hours of work they had to put in behind it. That's another thing too, because I know LPNs who were back in 2015 were making greater than $100,000 a year, but they was working double shifts and they were working 2 jobs. You know what I'm saying? So anything is possible. Anything is possible. I've never been the type to try to overwork myself. But you can go from being an LPN doing all that overtime to automatically being an RN making $70,000 a year working just your regular shifts. You know what I'm saying? Because the rate of pay will increase, so you can decrease your hours. When you go on Indeed and put that you're an LPN, you'll get a lot of job opportunities on there. But then go on Indeed and put you're an RN, you'll just see so many different opportunities open up when you become an RN. It was a shock to me when I got my RN and I just went on Indeed and I was just putting in, like, looking at, I was like, wow. I just felt like the world was my oyster. Like, I just felt like I could go eeny, meeny, miny, mo and just pick a job, and the rate of pay, it didn't always say what the rate of pay is, but just for me knowing what the rate of pay, what the average was, I was like, dang, I could work anywhere. Like, it's no limits. I can work anywhere. You know what I'm saying? But and now she may say, oh, I'll choose to stay in this field. I choose to stay here and I'll get an increase in pay. But she might decide 3 years later that, hey, I want to switch it up. But being that she has that RN, she can switch it up and have more opportunities of places to work to switch it up. If you get what I'm saying. So I saw the comments and I was like, how are some of these people nurses? And they're saying this, maybe they're saying what they're saying because they stayed on the same job for 30 years. So that's all they know. You can be an LPN working in long-term care, like I said, and then get your RN and boom, the next day you're a supervisor. You're in the same facility, your role has changed, and you're making more money, but you're still working in a nursing home. You know what I'm saying? Or you could go to school, become an RN, and then 6 months later, you get an offer to become the DON with no experience as being a DON now. That's the thing. No experience with being a DON, but you can become a DON. So she wasn't lying. And there was nothing wrong with her saying that she's going to, you know what I'm saying? She's an LPN. She's going to school for RN, but she's going to stay in the same job. Maybe she liked that job. Maybe she liked her coworkers. Maybe she liked the atmosphere of that place. Maybe she's more at peace in that place. And that is a big factor. I feel like a lot of people get their RN, they got dollar signs in their eyes. And I'm not going to lie, when I got my RN, I had dollar signs in my eyes, so I'm not going to lie. But I always factored in my peace when I worked on a job. Like I always say, I say in past videos, I was not at peace working in the hospital. Yes, I increased my skill set. Yes, it's, you know, it almost seemed like it's such an accomplishment to get your RN and go into the hospital. It was almost that, but I was miserable. I was miserable, y'all. I'm not gonna lie. I was more miserable in the hospital than I was in the nursing home. And so when I did leave the hospital, I just felt so much more at peace. Once I left that hospital for the last time in 2021, and that was only because, and that was a money move. I'm not even gonna lie to y'all, it was a money move. Those who watched my channel before, y'all know those contracts was very attractive, and I was definitely trying to get, you know, I was making money, good money with all my contracts when I was working as an RN in the long-term care setting. I was taking what I say LPN contracts, because LPNs could have gotten those contracts. Those contracts were actually for LPNs, but they wasn't going to turn down an RN who's willing to come in and work those contracts for the same amount of money. You know what I'm saying? They were attractive, but they were more attractive in the hospital. It was more than double what I was making on my contracts working. So I did return to the hospital. When I left the hospital originally in 2020, I left it to never return. I had no intentions on returning. I did return, I think it was 2022, and it was only because I wanted to up my skill, you know, get one of those. I think I returned in 2020, the end of 2021, and on into 2022, because I wanted to refresh my skills so that I could get a travel contract before before the money started looking funny with the travel contracts. And I did do that. I did get a travel contract, and once I left that, once that contract ended, I never went. I never entertained another hospital. I never entertained another hospital in a traditional sense. I did work at a psychiatric hospital, but it wasn't like a hospital setting. I'm gonna say it like that. It wasn't like a traditional hospital setting, but the name of it was a psychiatric hospital. So yeah, it's like, yeah, if you don't know, it's better to ask questions and just assume than just assume somebody is lying if you don't know, because there are plenty nurses I know who went to school for their LPN and they remained working in the nursing home with their RN because that's where they were comfortable. And hey, if I'm gonna stay, even with me, I remained being a floor nurse with my RN for a while. After I received my RN, I remained working as a floor nurse because that's where I was comfortable. I knew what I was doing. And hey, I'm making $7. Like I went from 20, when I originally got my RN pre-pandemic, I went from 20, I think I was at 20, what was that, like $26? And I got a job at $33 just for obtaining my RN. I got $33. I went up $4, $5, $6, $7 in pay just for getting my RN. No extra, nothing, no extra work that I put in at that job to get that. They just automatically bumped me up. So yeah, I just wanted to come on here and say that if you're an LPN and you're working in long-term care, a lot of you, I know you're going to want to go into the hospital. There's nothing wrong with that. There is absolutely nothing wrong with wanting to go into the hospital. Some of you may love it in the hospital. Some of you, it might be a good reprieve for you, you know, and I'm not knocking you for that. So like every hospital is not the same. I may have had the experience I had because I went to a level 1 trauma facility, and that's a little different than working in, say, a level 3 hospital. You know what I'm saying? Because even a hospital that I took my contract in, the work wasn't hard at all. It wasn't hard. I was like, had I been working here originally, I probably would have never left the hospital. I probably would have remained in a hospital setting. Every hospital is not the same, but I think being that I went to a level 1 trauma facility, it kind of just like turned me off from working in the hospital. then once I went back to I never left long-term care. I still would do a PRN, but when I went back to primarily doing long-term care, I realized the freedom that I had working as a long-term care nurse, and I didn't want to kind of give that up to go work in a hospital. And when I say freedom, I mean freedom as while I'm working, while I'm on the clock, the freedom to go sit in my car to recoup like 10 minutes. Like if it gets to be too much and I'm caught up on my work, the freedom to go sit in my car 10 minutes just to take a breath, you know, the freedom to go stand on the, you know, sit on the porch with the residents for maybe like 5 minutes, you know, the freedom to, you know, just be outside of the building for a few minutes, you know what I'm saying, when needed, as long as I'm caught up on my work or whatever, and my residents are good. The freedom to not have to deal with a patient that's in acute, and that not deal with acute patients the whole 12 hours of my shift. That type of freedom, that's the freedom I'm talking about. So yeah, y'all, so this is the end of my video. I am Nurse Muriel. I think on my next video I'm going to tell y'all about my trip to Jacksonville. I went to Jacksonville over the weekend. I enjoyed myself. I went to a Luther Vandross tribute, y'all. It was, when I say y'all, I enjoyed myself. I enjoyed myself. They did a good job. Anyway, y'all, I will talk to y'all later. Bye.